I tailor the sessions by starting with the scan and the report. So I know the exact treatment, the exact frequencies, the exact placement before I even go to touch their head. And it's not so different between the adults and the kids. When we're working with the electrical stimulation, there's a certain level of intensity, the frequencies, not the frequencies, but the power of intensity we use. For the most part, we use the same modalities. We can use the LED light therapy. We can use the PEMF, the magnetic force things, and we can use the electrical currents on little kids through adults. So the treatment doesn't change a ton. If kids are super sensitive, we can just, use one modality instead of all three. But we usually generally do quite well with layering, but it might just be like, how strong do we turn it up for the kids? We also may allow the kids to play on an iPad or distract themselves a little bit with something while they're getting the treatment so they can, tolerate it a little bit more or sit in the seat a little bit better, because we're talking about wiggle butts, right? Up and down and all around. You don't want them pulling off their stuff. So, we may allow them to do that, whereas we might encourage the adults to do something. If you're ADHD and, struggling with something, we may ask them to kind of focus on something that they're struggling with, or do brain training exercises on their phone, which will help strengthen some of the executive functioning. So while we're juicing it up, we're actually having them do some exercises as well while they're getting the treatment. So we're reinforcing that. So it's kind of a win-win.